Evidence shows that having the right type of maternity care will determine the best outcome for you and your baby. The first step toward a healthy and happy start for both mother and child comes down to two important decisions. Who is going to provide your maternity care, and where are you going to give birth? There are three main options typically available. Research shows that women in the care of midwives are less likely to have interventions, debilitating postnatal problems, and postnatal depression. And they're more likely to have a positive experience, be satisfied with their care, and receive more education and support than women receiving care from doctors. Midwife care provides continuous support throughout pregnancy, labour, birth, and transitioning to mothering, informs and involves women in decision-making, and avoids unnecessary tests and interventions. Midwifery-led continuity of care is provided in most birth centre public hospitals. Private midwife care is provided by a private group practice and gives you the option of having your baby in hospital or at home. Obstetricians specialise in caring for women with serious medical problems or who are at risk of developing problems. They usually approach birth as a medical event best managed by highly trained specialists. They have higher rates of interventions such as caesareans and episiotomies than midwives, even when the health status and risk level of women is similar. They do not provide continuous care or education for labour, birth, breastfeeding and parenting, and usually only appear at births without complications if requested. The rest of the birthing is managed by a midwife. Some general practitioners provide maternity care in conjunction with the local hospital doctors and midwives. Care by a private obstetrician involves birth in a private hospital and requires a GP referral. Shared care is when there is an arrangement for your pregnancy care to be shared between health professionals. The options are you can see your GP for some pregnancy appointments and also have appointments at the hospital in early and later pregnancy with midwives. Or you could see an obstetrician who would share your care with a midwife. Not all GPs or obstetricians provide shared care, so you would need to check with each individual provider first. Another care service for Aboriginal and Torres Strait Islander mothers is Birthing on Country. Birthing on Country aims to give the best start in life for Aboriginal and Torres Strait Islander babies and their families. This model of care ensures a connection to country and place that can be incorporated in any setting. And it's designed to meet First Nations people's social, emotional, geographical, cultural and health needs to provide better outcomes overall. Many women choose to birth in their home environment because they feel more comfortable and safer. Home births have a higher rate of high oxytocin levels, the good hormone that aids labour, intervention-free births, successful breastfeeding, and continuous care with a health professional you know. Birth centres are usually within a hospital and have a home away from home environment. Research shows that the benefits of a birth centre include having the best chance of achieving the birth you want, the least chance of intervention, including a caesarean or episiotomy, more likely to have skin-to-skin contact after the birth, a seamless transfer to a labour ward, and specialist medical care if you need it. The benefit of a hospital birth is knowing that every medical opportunity is readily available. The flip side, however, is that hospital births have a higher rate of unnecessary or unwanted intervention. Ultimately, when making these important decisions, go with where you feel safest and who you feel safest with. For more information, visit maternalhealthmatters.org.au.